Sensory processing disorder is commonly misdiagnosed. Its symptoms are similar to those of many other disorders, and symptoms can vary from child to child as well. Overall, sensory processing disorder is defined as the inability to use information received through the senses in order to function. It's not one specific disorder, but rather an umbrella term to cover a variety of neurological disorders that affect our ability to process the five senses. Sensory modulation is the brain's regulation of sensory input. It instantly adjusts and balances the flow of sensory information into the central nervous system. For example, in typical modulation, a girl playing jacks on cold pavement gets frustrated when she isn't able to play the game well because she's cold, so she decides to jump rope instead in order to warm up. In atypical development, such as sensory modulation disorder, the most common category of sensory processing disorder, a girl playing jacks on cold pavement can't concentrate and has trouble playing. She suddenly explodes, screaming that she hates jacks. She cries uncontrollably, is inconsolable, and refuses to eat lunch. Atypical sensory modulation development can lead to social and emotional problems such as poor adaptability, attachment problems to other people, frustration with tasks that others can do easily, difficulty with friendships, poor communication skills, academic problems, and other emotional problems like irrationality, stress, and being overly sensitive to change. Self-regulation problems may also arise, such as unusually high or unusually low arousal and activity levels. The child may always be restless and fidgety, or he may always move slowly and seem in a daze. Inattention and impulsivity are also common issues with SPD. Often, children with sensory modulation disorder respond in atypical ways to sights, sounds, and tastes, depending on whether they are over-responsive or under-responsive to stimuli, or whether they crave a certain stimuli, such as shiny objects, loud noises, or strong odors. For example, a child with SMD may push another child who accidentally brushed against him because he hates the sensation. Other categories of sensory processing disorder affect children in other atypical ways. For example, children with sensory discrimination disorder have difficulty distinguishing one sensation from another, and children with sensory-based motor disorder have trouble with fine motor skills, movement, balance, and coordination. There are several possible causes of this atypical sensory development, including a genetic or hereditary predisposition, prenatal circumstances like chemicals, medications, or toxins absorbed by the fetus, the mother's smoking, drug, or alcohol abuse, unpreventable pregnancy complications like viruses or emotional stress, or multiple births like twins or triplets. Other causes might include prematurity or low birth weight, birth trauma due to emergency C-sections, lack of oxygen, or surgery soon after birth, postnatal circumstances like environmental pollutants, excessive stimulation like child abuse, insufficient stimulation or limited opportunity to interact with others, a lengthy hospitalization or an institutionalization in an orphanage. Looking at sensory processing disorder from the ecological perspective, we can see that children's environments play a major role in how this disorder affects them. Everything from the material of one's clothing to the proximity of other children to the food eaten for lunch can affect individuals with this disorder. Bronfenbrenner's model can be used to show these types of relationships between various systems in a child's life. On the microsystem level, this disorder has a major effect on families. Parents may get frustrated with their SPD children's behavior, even though it's beyond their control. Before receiving a diagnosis especially, it's hard for parents because they believe their child is simply acting out. The school setting is another difficult place because teachers may not know about or understand the disorder, and children with SPD often have trouble academically. Children with SPD tend to have a hard time making friends and communicating with others, and may get frustrated if they can't perform as well as the other kids around them. Another factor in microsystem is health services and the family's ability to attend occupational therapy or other types of this treatment for the disorder. The child's own biology as well can be included in this system. The mesosystem level refers to relationships between the different microsystems. One major mesosystem affected by SPD is the relationship between families of children with the disorder and the school system. Parents need to communicate with school staff and let them know about the disorder ahead of time and explain how the school can help their child succeed. In the exosystem level, industry is one factor because one possible cause of SPD is environmental factors such as toxins that may have affected the baby before birth or even after birth. The macrosystem level refers to the culture the child lives in. In this level, one factor is socioeconomic status, because treating sensory processing disorder requires not only a great deal of time and patience, but often money as well. The attitudes that others have towards individuals dealing with sensory processing disorder can also be included in this level, since children with the disorder are often believed to be misbehaving or causing trouble for no apparent reason. Although sensory processing disorder affects lives on many levels, it can be helped with patience and understanding on the part of families and teachers, as well as various types of therapy. Children with sensory processing disorder aren't bad kids or troublemakers. They simply sense the world in a different way than we do.